So in 2016, I took care of a cancer patient who just wanted to go flat. And for everybody listening, I appreciate you having me on to explain this to your audience. There's options in breast reconstruction. You can have no reconstruction and have an aesthetic flat closure, which is one of the options. You can have a implant-based reconstruction. There's ways to do that. And then you can have what's called an autologous reconstruction, which is usually your own tissue. And that's what I specialized in for about 20 years, using microsurgery to sew together blood vessels to reconstruct a breast. And so this patient wanted to go flat. So they had an implant. And for everybody listening, I was trained specifically in cancer reconstruction. And when we took down a reconstruction, we'd always take all the capsular material out. That's what your body forms around an implant. So that scar capsule would always get sent to pathology so they make sure the patient didn't have recurrent cancer. We also checked to make sure there was no infection because there was an implant there. And so when I did that for this patient, all of the testing came back negative for cancer, which is obviously paramount, but she had a E. coli infection.
Wow.
So for everybody listening, E. coli infection, you've heard of all the food poisoning that can happen with E. coli. This was in and around her breast implant, and this was enough bacteria to truly be called an infection based on the hospital criteria, which is 10 to the 6 or over 100,000 per high power field. So that's very, very bad. Obviously, my sister passed away this past year of cancer, breast cancer specifically, and had someone miss that on her, I'd be really pissed off that had happened. So we went back through all the data for the case, and we didn't have any clues. There were nothing on her blood laboratories. There were nothing on her studies, her CT scan or MRI. There was nothing to tell you that was there. So I treated her appropriately based on what was found with antibiotics, and magically she got better.